Hello and welcome dear viewers to the video on standard dissolution testing conditions and acceptance criteria. When you are performing the dissolution testing, the dissolution parameters or conditions, or you can say like dissolution test parameters, should be standard. As per the regulatory requirements, the dissolution testing conditions and parameters should be standard and should be mild. So this video is regarding the dissolution conditions which are standard and which are mild in nature, so that the dissolution will be meaningful test, will be having the biorelevance, and also will be related to the in vivo behavior of the formulation. If dissolution conditions are not standard, that means these may be stressful to the formulation, then a release profile will not be proper. If dissolution testing conditions are not mild, uh, or you can say very mild, then there will be lot of variation in the batch to batch formulation, also unit to unit, and there will not be any reproducibility in the formulation because of the test parameters. So let's understand these standard conditions in detail. As per the regulatory authorities, for oral formulations, generally basket method and paddle method are used. Basket method parameters or USP apparatus 1 parameters are the stirring rate of 100 rpm, media volume of 500 ml, and for immediate release formulations containing the soluble APIs like BCS class 1 and 3, the media is required to be 0.1 normal HCl in the aqueous medium without any surfactant, and the temperature will be 37 degrees Celsius with the limit of 0.5 degrees Celsius. So these standard conditions are for the formulations which are immediate release and containing the highly soluble drug substances. For formulations which are immediate release but contain the low soluble APIs, for those these conditions may not be applicable, or these conditions may be changed. But always remember and always understand that the dissolution conditions are required to be mild. For example, basket method 100 rpm, 500 ml, and media 0.1 normal HCl without surfactant is the mild condition, or it is the standard condition. If increasing the media volume to 900 ml, then justification will be required and data will be required for both the media volumes 500 ml and 900 ml to justify that how 900 ml is having impact onto the dissolution, but it can be used. Surfactants are not allowed or not utilized in the media if the formulation contains the highly soluble APIs. If media other than 0.1 normal HCl is used, then justification will be required. Similarly, coming to the paddle method, that is USP2 apparatus method, stirring rate of 50 rpm is standard rpm. If the higher rpm is required like 55, 60 or 75 rpm, then justification will be needed. Media volume of 500 ml is standard volume and justification for 900 ml will be required. Media will be point on normal HCl in aqueous medium without any surfactant. If any other is used or proposed for the dissolution test, then justification will be required. The logic behind these standard conditions are like, if you increase the RPM or if you increase the media volume, then the dissolution test may become under discriminatory and there will be loss of discriminatory power. There may be chances that the dissolution test is not having specific power or discriminatory power to detect the mismanufactured batches and the good batches or bad batches. So standard conditions or mild conditions are to be used for dissolution testing. If formulation is not immediate release formulation, or if it contains the low soluble API, then surfactants can be used. Also, then the media volumes can be different. But as there is no problem of seeing condition for the highly soluble APIs, 900 ml media volume is sufficient, and basket method with 100 rpm is sufficient, and paddle method with 50 rpm is sufficient. So whenever you are working on to the IR formulations, then always remember that media should be point on normal HCl and volume should be 500 ml. Because all these IR formulations are going to dissolve in the stomach fluid volume and will release the content in acidic media. So there is no need to go for other medias if the drug is having good solubility in all the pH medias. Coming to the specification or acceptance criteria, for IR formulations generally 80Q in 15 minutes is required, and if it is not meeting the requirement, then go to 80Q in 30 minutes. But generally 70Q, 75Q is not recommended. Q point of 80% in 15 minutes means it will be 85% as S1 criteria on 6 units, 80% as S2 criteria on 12 units, and S3 criteria for 24 units. So always set specification as per S2 criteria with Q limit of 80%. That may be in 15 minutes or 30 minutes. But if the formulation is not showing release of 80% above in 15 minutes or 30 minutes, then it might be problem of API solubility, or it may be because of the low API solubility. Then you can go for the surfactants and you can use the other medias as well. Also, stirring speed can be increased to have the dissolution or percent drug dissolved in 15 minutes or 30 minutes. So this is very important to understand the what are the standard conditions or mild conditions for dissolution testing and what is the acceptance criteria for IR formulations. So I hope you might have got the information for this topic, and always remember, nowadays regulatory authorities are very stringent for dissolution conditions and acceptance criteria. So from initiation phase or from research phase, the dissolution testing parameters and acceptance criteria is required to be finalized, and on that finalized method only the stability studies are required to be performed. Otherwise, there may be query on dissolution, there may be query on the dissolution method development and the acceptance criteria. So thank you for watching the video, and I request you to Do like, share and subscribe to this channel. Thank you.